I can explain the lymphatic system. When you have tennis elbow and you are using this movement all the time, producing more garbage than your body is draining.
Do you recommend that they're drinking more water, like supporting the lymphatic system in other ways as well?
When people have a trauma or they have huge emotional stuff, they have stiff neck, they have stiff shoulders.
Well, today I have the pleasure of speaking with Rune Abo, and he is the author of the free ebooks, Natural Sinus Drainage. His mission is to share his knowledge to help people to get pain-free with his very special lymphatic massage techniques, which I am so excited to be learning these techniques right from the master himself. He is also the founder of painfreeyou.com, so you got to check that out. And he's helped over 1 million people now, both in person and through his quickly growing social media following. So great to have you here, Rune. Thank you for taking some time to speak with me today and, of course, to share with our followers some of these techniques that are really, really fascinating but very effective at the same time.
Thank you. It's so nice to be coming to your podcast and your show, because my passion in life is to share the knowledge so people can can learn to fix themselves.
Yes.
Because my dream is when people can, from Jamaica or wherever they're living, they can just watch a video and maybe they have a pain somewhere, and maybe a little trick can help to drain and fix themselves. So that's my mission and passion in life.
Well, I'm so excited about this and very timely for myself as I was chatting with you before we, came live, that I actually have some clogged sinuses myself. And this is one of the first videos that I actually saw of yours online about how to drain the sinuses. So yeah, I'm saving that up towards the end of the podcast today. And you're going to show me how to do that. And we're going to try, because a lot of people will be listening to this, we'll try to sort of give some context around visually what we're doing if they're not watching this, but listening, we'll try to explain it in that way as well. But to start things off, can you tell us a little bit about what is the lymphatic system and why is it so important for our health?
I have been treating 25,000 people in Norway, and with my glasses on, I can explain the lymphatic system. So the transport of garbage, easily put, is the lymphatic system's job. So when you have pain somewhere, it's the tissue fluid flow and the lymph flow that gives pressure. So if you have headache or you have a neck pain, it's clogged lymphatic system because the drainage is blocked. So the muscle are contracted, and the muscle is the pump for your lymphatic system.
I see. So if the muscles are stagnant, the muscles aren't moving, and now you've got, blocked up blood flow as well. That is all part and parcel with the lymphatics, correct?
Yeah, so the lymphatic system are going to, it's a cleansing system.
Yes.
But it's also your immune system.
Right.
So transport of the lymphocytes and the defense in your body. But we have found a way by opening up the smallest passage in the body, we can actually, because in my world, my glasses on, pain is just unregulated fluid flow, tissue and lymph fluid.
So that's an interesting perspective then, maybe something that we don't hear so much in mainstream medicine. And that is why I'm sure you've had so much success with addressing it from that lens and from that perspective, that you can, really effectively help people and they can help themselves. And that's why we're here, because you're going to show us some techniques that we can work on for our own issues to help to at home. And, that's the other great thing that I love about this is that it's free. You share so much and you're so knowledgeable and you share so much, free content, free information for people to really get pain-free, which I commend you for that amazing, amazing work.
Thank you. I think I have it from my parents, because they love to give. When they give, you get energy back, or you get karma, whatever you believe on. But I enjoy my job. I'm treating 15 people every day, 2,500 people every year.
Wow.
And I've been doing that for soon 11 years now.
Amazing.
But for me, that was not enough. How can I help more people? So
Yes.
I have a very profiled person in Norway on my bench, and he was challenging me like, okay, Rune, now it's time to show the world what you do. And he's like, I respect him dearly. So when he said, you need to put your neck out there, okay, I tried to
Uh-huh.
put my neck out.
Yes.
And I've posted one video every day for over 2 years now. And
Amazing. Yeah. That's a lot of
so,
work. I know.
yeah,
You don't have to tell me. It's a
yeah, it
lot of work and
is. Yeah.
a lot of dedication and making sure that you are, putting out the content that is going to help people as well. It's one thing to post something, but you're posting, really valuable content every single day. So we thank you for that. And I know all my followers are going to check out your channels so that they can learn more. How did you get into this line of work to begin with? Like what's your story? How did this happen?
Okay, here's the story, the short version. First, I was a personal trainer, and every person coming to me was like, "Oh, I have shoulder pain, so I cannot do the deadlift. I have
Ah,
back pain, so I cannot do the squat." Okay, so I asked the person with back pain, uh, we need to address the back pain and connect the muscle in your back. And they tell me, no, 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 the doctor says, and my physio,
physio.
or
Yeah.
yeah,
Yep.
tells me that no, 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 I cannot use this exercise because it will hurt my back. Then I
Ah.
tell them, okay, how long have you listened to your doctor?
Uh-huh.
2, 3 years, okay, good. But can you trust me for two sessions? Okay, they trust me. And after 2 sessions, the back is good again, or not 100%, but like 90% good. So we can
Wow.
start doing that, doing squats. So it's all about connecting the muscle, activating the pump. And then I heard about there was a guy, there was a guru or a guy somewhere, and people were telling me, you have to go to this guy. He's a muscle therapist. He's fixing people like so fast.
Uh-huh.
It's very painful, but he's fixing people. So okay, I tried to call him, and he answered, "Come to me, and I will try to show you these techniques." So I went to
Oh.
him for like 11 years ago, and he was teaching me about the lymphatic system and the muscles, but he didn't have all the answers. So I asked a lot of questions, and he was angry at me sometimes, but I'm so curious. I want to learn more, and 11 years later, I'm here with you,
Yes,
trying to teach
exactly.
the world the same stuff.
Amazing. That's an amazing story because yeah, we're I think we often have to learn for ourselves and figure things out for ourselves. That's, for greater humanity that is where, some of this is born and that we're able to hit the larger audiences now with social media, which is amazing to be able to help people
Yeah.
because yeah, if you're in pain, that is affecting your quality of life. And if there is something as simple as, a self technique that you can really tap and tune into, this is amazing.
I think so because um, for like the 1st of January, I had 200,000 followers, and now I have 1.2 million followers,
Wow.
and that's like crazy. And people are commenting like, "This works,"
Yeah.
and
Yeah.
that's like dream come true for me. I'm helping people just with a video, and
Yeah.
one video at a time, we're gonna make this world less painful.
Okay, let's get started now. Let's get into the
Okay.
nitty gritty. Let's start with loud and sore knees. What is
Yeah.
going on? I know this is really common for people that are aging. They hit, age 40, age 50, and they're like, what is going on with my knees? I'm sure it's something that you
Mhm.
see day in, day out in your practice. Can you show us some
Yeah.
techniques for this?
Before I show you the techniques, I will explain so the visually part of it, because this is logic. Because when you have pain in your knee, your thigh muscles, they are long as connected to your hips, and
Yes.
when they are contracted because of overuse, they will pull on your knee. So when
Uh-huh.
they are pulling on your knee get like pulled, and you are walking on your knees, and then you get pain in your knee. This is the
Yes.
fluid flow. You're blocking the fluid flow to your knee because the muscle is contracted and not pumping the lactate or cleansing the blood. So the
Yes.
tissue fluid and the lymph fluid is clogged. From my perspective, of course.
And would a major cause of this be sitting a lot? And
Of
if
course.
if you sit and you're not as mobile as what you were when you were younger, because usually
Yeah.
little kids, they never complain about their knees, but as we get older and we're working, we're sitting at our desk and we're driving and we're doing all these things that we shouldn't be, probably in terms of the
Yeah.
grand scheme of things. So sitting would be
Mm.
one of those reasons. Yeah. Okay. Makes
Yeah.
sense. Makes
So
sense.
it makes sense. So I will try to show you now how you can, because there's some easy techniques like you can do every day, and the brain, a little bit painful, but your brain will stop you before you're hurting yourself.
Okay.
So
Perfect.
I'm going to show you the technique I'm going to show you. Before I show this, I will show you the technique first, because I never been in a fight in my whole life. But my father showed me a technique. If I get into a fight, I have to do this. I have
Uh-huh.
to use my knuckles, but I put this finger a little bit higher, like this.
Oh,
Yeah.
okay.
So this will not go away.
I
So when
see.
if I go shoulder, I go like this.
Okay.
But I will use this on my thigh. So I will show you now. Okay.
Okay. So
Shall we
that middle
go?
finger is higher than the rest of your fingers when you're making a fist. Got it.
Yeah, exactly. A little
Got
bit
it.
higher, because that will not give up
Okay.
or give in.
It won't give
So
in.
I'm gonna show you the technique now.
Okay.
So you have a thigh muscle. Here's the thigh muscle.
Yes.
It's contracted. Okay.
Yep.
So what I'm gonna do, I'm gonna use my knuckle like I showed you, and I
Okay.
go into the thigh muscle like this,
Okay.
and I'm gonna pull it like that. I'm crossing the muscle fibers. In the
Okay.
middle of your thigh, you go in with your knuckle,
Yeah.
go in, and I cross it like this.
Okay. So for people that are listening to this from your tensor fascia lata on the side, you're going medially towards your inner thigh. So from your outer thigh to your inner thigh, you can usually feel the bulk of your quadriceps muscle there, and that's what we're rolling over with. Our big middle finger is protruded in a fist, and we're going medially. And how many times do you do that?
It's not about how many times, it's about the tenderness, the tension in the muscle.
Okay.
What does it say? We go knocking it like this, and it should not be tender, it should not be swollen. So I can
Okay.
pinch it, I can
Yes.
use my knuckle, because if this muscle is contracted, it will pull on the knee like I told you.
I see.
So the muscle is quite long from the hip to your knee.
Okay.
So I'm pulling it like this, or I can use my climber's grip like this,
Okay.
go in like this, and I pull it like that.
Okay. So climber's grip with the fingers as well.
If you pinch this muscle, it should be soft. It should
Okay.
not be hard.
Okay, I'm pinching mine. Oh, there's some hardness there. Okay, something that I need to work on.
Exactly.
Absolutely. Okay, that is fabulous. Okay, so basically you could do this daily, once a day, twice a day. What do you recommend? Like first thing in the morning when you get out of bed, or?
When you feel that you have knee pain, if you have knee pain or you feel some tenderness in the muscle, you can do this.
Okay.
I have had many people doing this, like, oh, I have tenderness in my thighs. It's hard to get up off the chair. It's hard to sit down. If they do a lot of squat, this, oh, my thigh muscles are so sore.
Yes.
But if you're doing this, the tension in the muscle, because I think the tension is the fluid flow. So it's
yeah.
the tissue fluid and the lymph fluid is in your fascia. So we need to drain the fascia by doing this, and you're flushing the fascia and the tissue fluid.
Okay, and for people who don't know what the fascia is, that's just our covering over our muscles. And all our fascia is one big sheet in our body, so everything is connected to everything else, which I think is really interesting when we start to use your techniques. I'm sure that, if you're working on, let's say, the quadriceps, like we just did for the knees, that could effectively maybe get some lymph flowing and affect other parts of the fascia in the body as well. Is that something that you've experienced?
Yeah.
Yeah.
So when the thigh muscle, the vastus lateralis or lateralis is tight or shortened, it will pull on your hip as well, and will get some bad circulation to your hip, and your pelvic is tilted, and it give you back pain and so forth.
Okay, so this is it's so connected. So this could affect, your hips and your low back as well. Amazing, amazing. Okay, let's move on now to tennis elbow. For those of you who have, seen some of my content before, that I recently picked up, started playing pickleball. Do you have pickleball in Norway?
I don't know. What
It's
is
like
pickleball?
tennis, but it's like mini tennis, and you use a ball
Yeah,
that has
yeah,
holes in it. Have you seen it? Maybe it's not there
yeah.
yet,
I've
but
seen it.
here, yeah, okay, here in North America, it's like the fastest growing sport. It's crazy because it's less intense. You need maybe a little bit less of a skill set compared to tennis. And
Wow.
I'm a tennis player,
Yeah,
but yeah, pickleball is amazing, and so many people are picking it up now as a social thing,
yeah.
but you can develop, I call it pickle elbow or tennis elbow, very
Mm.
similar because of the motions that are happening. So let's talk about tennis elbow. How do we fix it?
Okay, I'm gonna try to make it visual for you guys. So when you have tennis elbow and you are using this movement all the time, you are using the muscles all the time, and you get overused muscles. The muscles are thinking, okay, I'm producing garbage. The garbage is not drainage. You're producing more garbage than your body is draining.
I
And
see.
where do the garbage go? It will go to the tissue, to the fascia, and the fascia gets stiff, and the lymphatic system cannot drain it fast enough. So, where is the arm connected to your shoulder blade?
Yes.
So, we need to drain this muscle. It's a latissimus dorsi or
Right?
something like that.
Yeah.
Yeah, so I go in with my thumb. I'm gonna pinch like this, go up in this area, holding the pinch like this. So
Okay.
I go a little closer, holding it like that,
Uh-huh.
and I'm squeezing it, and I'm pulling downwards,
All right.
holding
Yeah.
the latissimus dorsi muscle, holding
Okay.
it, going
Uh-huh.
quite deep with my thumb, holding it, and I pull down.
Down. Wow.
It should not be tender in this area. Should not be
Yeah.
tender, should not be swollen.
So isn't that interesting that the latissimus dorsi in the back is connected to the forearm with tennis elbow? I mean, who knew?
The,
Amazing, amazing.
yeah,
So again, yeah, if you're feeling tension there, again, I feel a tender spot myself. No wonder, because
exactly.
I play with my right hand, so that makes sense. Yeah. Okay,
But this
amazing.
is only part one. This is
Okay,
part one because
okay,
now
continue,
we
please. Yeah, yeah.
yeah, now we open the drainage to your shoulder, and the
Okay.
smallest passage for fluid flow is the shoulder.
Really? Because maybe we
Okay,
should
open up
say,
now.
yeah, because I mean, our main lymphatic area is in our torso, correct? So
Correct.
everything has to
But
drain back and come back towards the heart. So if we're starting,
it's a loop
okay, and you're saying the smallest passageway is through the shoulder.
because we are like sitting on the office or we're
Uh-huh.
stressing like that,
Yes, or on our
and all the
phones.
muscles. Yeah, exactly. So all the
Exactly. Okay.
muscle behind there,
Yes,
they are like too overused
I see. Amazing.
in my world.
Yes, of course, of course. Well, it makes
Yeah.
sense. And that's why, I think a lot of people are getting these issues. Okay, so what's part two now for a tennis elbow?
Okay, part two for tennis elbow. I have now opened up the circulation to your latissimus dorsi, to your shoulder. So now we're going to open up the shoulder. So we have three muscles to your shoulder. The
Yeah.
main muscle for tennis or the pickleball is the muscle in the middle. What is it called? I don't
The
remember it.
deltoid. Yeah, the medial deltoid.
Deltoid, yeah.
Yes.
So I go in with my thumb like this.
Okay.
I go in and I pinch it like that. This. If you
All
have
right.
nails, you can use your knuckle again.
Okay.
So going with your knuckle, like making a fist and
Yeah.
the
Your middle.
long finger knuckle a little bit
Okay.
higher.
Yeah.
I go in like this, squeezing
Okay.
it,
Yeah.
and I go like that.
Oh, rolling. Oh, yeah, I can feel that. Wow. Oh my
Yeah,
goodness.
it
Woo!
should not be tender, should it not be hard to do this.
Oh
It
yeah.
should be soft when you do like this.
Yeah, mine's not soft. Mine is not
Not
soft.
soft.
Oh my
Yeah.
goodness.
So all
Oh,
the
this is
movements
good.
like this,
Yeah, exactly. And
then you
whacking
use
it.
this
Yeah.
over too much. Yeah.
Okay. Well, that,
Then the
yeah.
third part.
Oh, part three. Yes. Okay.
Yeah, part three. That's the tendonites. No, what's the tendons? The
The
tendons in
forearm. Yeah.
your forearms. Yeah, we have the tendons to this finger, the long finger.
Okay.
If you move that finger like this, you can see the tension in it. And we're
Yes.
gonna go for this muscle. Go in with my thumb like this.
Okay.
I go in, squeeze it quite deep,
Yeah.
and I pull I'm crossing the muscle fibers
Yeah, got it.
like this. Yeah.
Yeah. Oh,
If
yeah.
this is hard part, use your knuckle again. Go in with your knuckle, and you go over it like this.
Oh, wow. It's like a satisfying pain when you do that
Yeah, exactly.
to
So
relieve that
this should
tension.
be soft. You can see my skin now is
Yeah.
quite soft.
Yeah. Wow. Yeah, amazing. Yeah, I can really feel
So the
that.
smallest, yes, exactly.
Yeah.
The tissue fluid and the lymph fluid is blocked, so it is like the garden hose. When you go, if you get a bend on the garden hose, the
Yes,
water will stop or get
exactly.
less. And the same here. The tissue fluid wants to go onwards, but it's a small passage because you have overused the muscle. The
Uh-huh.
muscle gets contracted, and the fluid builds up.
Wow. So now it's draining back through my shoulder and back into the main lymphatics in my
Yeah,
torso. Yeah, I can
exactly.
actually
Now the
feel it.
loop is going on.
I can feel it right down into my hand. So that,
Exactly.
because often, yeah, I can feel that sometimes in my yoga class that I feel tension in my wrist. So yeah, well, this is going to be, maybe we should talk about the wrist as well while we're here. Or would that be the
Of
same
course.
move? The tennis elbow would be the same, or there's something more specific for the wrists?
Yeah, it is. Because there is a small passage down here.
Okay.
This is a little bit hard thing to do because we're gonna go climber's grip and we're gonna pull it like this, holding it, and I
Uh-huh.
squeeze it with my fingers. You can actually hear the sound.
Yeah, I can hear that. Woo!
Yeah.
Oh my goodness.
So I would recommend try to use your palm like this,
Okay.
going up like that, and I
Uh-huh.
pulling like this, twisting your arm like that by
Wow.
holding the pressure down.
Huh.
But this is the smallest passage for your wrist,
I
this area.
see. Okay, I'm
So
gonna
you can
work on
see it
that
there.
one too. Yeah.
Yeah.
Okay. Yeah. Oh, yeah, now I can feel it. I can feel it kind of pop a little bit.
Yeah, you're gonna feel it pop. Press pressure down and
Yep.
you twist it.
And you twist the affected arm, not your treating arm.
Yeah,
Wow. Yeah, I can
exactly.
feel that. Oh, yeah, I felt that. Oh, that's so good. Well,
So
I'm
now,
gonna be all limbered up after this. This is so great. Okay, perfect.
so when a person come with a car mechanic comes to the bench, I try to explain to him it's like the hydraulic on your brakes. If it's
Ah,
not enough pressure around,
yes.
your brake will not work. Same here. It's not enough fluid pressure. It
Uh-huh.
will stop with the smallest passage. We open up the smallest passage, and you will drain it normally.
Wow. Yeah, it makes total sense. Why I've never heard this before. It blows my mind. So this is amazing. I'm so glad that you're here. Okay. Let's move on
Thank you.
to the head and neck now. So I know that for a lot of people, headaches, tension headaches are a big deal. Um, what can we, or actually, did we finish the shoulder? Was there anything else for the
Yeah,
shoulder before we move on? Or we're good with the shoulder now?
yeah,
Yeah. Okay. So for frozen shoulders, doing that, the move on the deltoid would help with the frozen shoulder as well, right?
yeah. But the frozen
Okay.
shoulder is could be quite complex.
Okay. Okay. Yeah, of course, because there's so many little muscles internally as well. Okay, let's move on to head and neck. Tension, headaches in general. How can we help
Mhm.
ourselves here?
Okay, again, with my glasses on, I will try to explain to you in my world when people come to my bench and say, "Oh, I have a headache," and okay, where do you feel the pressure? I ask them.
Yes.
And I say,
Okay.
okay, pressure, I have pressure in my forehead. Okay,
Yeah.
so if you have pressure in your forehead, we need to think, where does the fluid stop? The tissue and the lymph fluid. So if you have pressure like in this area, and I'll take off my glasses now, we
Okay.
have lymph, lymph node just at the start of your eyebrow. There's a
Okay.
lymph node.
Yeah.
I go in with my thumb just at the start of my eyebrow. I go in like this, squeeze upwards, and I pull. I'm rolling over the bone.
Yeah.
Can you feel it? It's a
I
little
can feel
knob
it.
there. If you,
Yeah.
yeah, you can also do like this,
Okay.
holding my four fingers on my forehead. I go
All
in my
right.
thumb,
Uh-huh.
just below. You can see here or hear it. You can pop it like that. And if this is the hard part, if you don't manage to drain that lymph node, you can feel a little pea or a little like small knob.
Uh-huh.
And that, if it's tender or swollen, it should not be tender or swollen.
Okay. And
And
you,
then we drain it like that.
and should you be able to feel it? Like you really shouldn't be able to feel that node, right? If it's working properly. Okay,
Exactly.
so
Should
and
not be
that
swollen or tender.
you may feel it more on one side than the other, correct?
Exactly.
Yeah, I'm
It
feeling
depends
it.
on if the lymph node is swollen.
Yeah, I'm definitely feeling it more. Like I said before we came, that my sinuses have been blocked up the last few days. This is perfect timing for me to start to drain all of this out that I didn't even think of or know before. Okay,
So,
so
so when this lymph node expands, it
yes,
will drain and it will block the drainage, normal drainage. And you have lymph veins, and we have blood veins and nerves in this area. And those lymph nodes get too big, and they will put pressure on the nerves and pressure on the blood, and then it will give tension headache. In
headaches.
my
Wow.
world,
Yes, yes.
yeah,
Okay, so that's a good one. What else can we do for our head, our
yeah,
sore head?
yeah. And so if I have tension headache, like more in the jaw area or the ear area, or like in this area, just
Yes.
yeah. Then we have to drain maybe the sinuses, or there are two big lymph nodes in this area, and we have to drain those. So I again use my thumb, and
Okay.
this video you have been watching, right? You have seen this
Yes.
video before,
Yes.
yeah. And that video have been watched now, I think 65 million times on
Oh
social
my
media. This video,
goodness. Wow.
so that's
Amazing.
crazy.
Amazing. And this is
So
how I found you was this video was sent to me on my algorithm
exactly.
and yeah, now we're speaking with one another. It's amazing. Okay, so yeah, show us
Okay.
this
So I
famous
go,
viral video. Let's go.
yeah. So I
Yeah.
go below the cheekbone. I go
Yep.
quite deep, as you can see, and
Yes.
I'm gonna squeeze it inwards, and I
Uh,
pull upwards.
And up.
Squeeze inwards, pull upwards.
Okay.
There we go. Little bit more into your nose, like that. There we
So
go.
towards the
Squeeze
nose
it
and
inwards.
up. Yep.
Yeah. So the lymph node is located right with your eye, and there we go.
Okay. Yep.
And in the center of your eye, go straight down, and you can feel it. So this lymph node should not be swollen. It should be small, and you
Okay.
can also squeeze it like this. There should not be a little bump there. It should be like
Nice
smooth.
and smooth. Okay.
Yeah. And if you could put on some cream, I have a lot of people commenting, "Oh, your skin! Don't ruin your skin." And I say, "Okay, but the circulation to your skin comes from the inside, not the outside." In my
Right.
world.
Yeah. Yeah.
So I go in like this, squeeze upwards.
Okay.
When this lymph node gets smaller, it will not put pressure on the nerves or the blood or the nerves.
Okay.
This expanded lymph node will not, doctors, like medical doctors, tell me there's no lymph node there, okay? But in my lymph maps, there's two big lymph nodes. And the normal drainage is not from the lymph node. The lymph node is not draining the sinus, it's the expanded lymph node that blocks the normal sinus drainage.
Ah.
So,
Well, isn't
yes,
that
so by
interesting? Yeah, because yeah, we've
exactly.
always heard, right? Or if you go to the doctor that there's a blockage happening because there's mucus buildup or whatever in the actual cavity in the sinus, but there's lymphatics there. So that's the missing link, I think, for a lot of people, and that you can manually drain it that's a huge point.
Yeah, exactly. So when I started this one, learning that the lymph nodes are regulating the fluid flow and the lymph nodes are draining the tissue fluid, then this knowledge was too big for me. So I have to share this knowledge so people can actually fix themselves.
Right. Yeah, amazing.
Yeah, so
Yeah,
that was my
because
main goal.
and that and that's why you've been able to help so many people with, the drainage of the sinuses, probably saving a lot of people from going to the doctor and, maybe getting prescriptions and things, which I'm all about, definitely doing all things natural. And that's, why I educate people as well. So that's fantastic. Okay, how else can we help our sinuses? So you said, so that's sort of the first move, is that you have to free that up. And would you do it bilaterally? Would you do it on both sides, even if that one side feels more blocked? I would probably think that you would do it on both sides, correct?
Yeah, do both sides. But someone say, oh, only blockage on one side, but you can check both sides. Where's the most swelling? Open up the one side, can also drain the other side.
The other side, yeah. Okay, perfect.
So do both sides, because then you get more tissue fluid flow, more pressure, and the lymphatic system and the muscle are pumping this onwards.
Yeah, I can already feel that I'm breathing better than I was when we started. So it's instant relief, which is amazing.
Exactly.
Yeah.
The fluid goes onwards when it's like a balloon. The balloon is going up, it's expanded, and now it's smaller. So now it's nice passage for the fluid flow.
So everything is flowing. And do you recommend, when people do your therapies, do you recommend that they're drinking more water, like supporting the lymphatic system in other ways as well?
Yeah, and moving.
Just moving in general.
Can I do some sport? Yeah, because when you're moving, they said like if you 60% of your maximum heart rate, then the blood is filled up maximum into your heart, and you are cleansing your body. If you're going more than 60%, you're like producing garbage. So you need to cleanse the body afterwards. So if you have 200 in the maximum pulse you have to not go over 120 in pulse. You have to go 110, 115 for a walk, and then you're gonna pump the tissue or the garbage onwards.
Okay, that makes sense. And then, of course, I just have to say for my listeners as well who follow me, making sure that all your emunctories are open, so your organs are working properly, you're pooping every day, and that we have an evacuation on a grander scheme for physiology, right? So that things are flushing through and the water is important for your kidney health and flushing and keeping your immune system strong. Because do you find too that people that are immunocompromised, that they have maybe more lymphatic issues?
I would say you do not want to have a strong immune system. You want to have a stable
and balanced. Yes.
Yeah. So when the doctor comes to me, the medical doctors, I have a heart specialist coming to me, and he says to me, how does this work? Do you have a theory? And I tell him, it's the garden hose theory. When you have a bend on the garden hose, the tissue and the garbage not goes onwards, and then you get problem. Then you get garbage build up, and the sewage system is not working, and the body is telling you pain. But I want to know the medical thing. And I say, okay, let me tell you the medical thing. It's the microenvironment in the cell. So if that fluid is not stable, it will. I don't have the science about this, but we know the science. If the tissue fluid, the microenvironment in the cells are not stable, they get critical for the cell, and the cell is not working.
Right.
So what I'm doing is open up for the fluid flow, so the microenvironment in the cell is stable.
Makes sense. And we know that our cells communicate with one another as well. So when there is an issue, then it causes changes in even the electromagnetism of the cells, and it's like a cry out for help, right? So when we have blocked lymphatics, it could be the body is crying out for help, that it needs to be potentially manipulated manually, like with your technique, just to get the fluid and the flushing. It would be interesting to see also the emotional components because I'm all about the mind-body connection as well, and some of the emotional components and how that relates to the lymphatics and the stuckness. If people are stuck in their mind, maybe they have more lymphatic stuckness as well. People that don't have a free-flowing, mentality, perhaps. I don't know. Is that something that you've noticed? I just got to ask.
Yeah, it's hard to tell, but when people have a trauma, or they have huge emotional stuff, they block up the whole body. You can see they have stiff neck, they have stiff shoulders, and because I've been treating 25,000 people, you see a pattern here. So I
Uh-huh.
can see the pattern. Okay, so the people haven't told me they have a trauma or they have people died close to their family, but I can feel the tension, the way in the tissue. I can okay, the tension in this muscle is funny. Why is it funny? Because
Ah,
yeah,
yeah.
I can feel the tension.
Wow.
Yeah. Sounds
Amazing.
weird, I know. Sounds weird, but there's a
No.
difference. Yeah.
Yeah, well, it doesn't sound weird to me because I'm all about that. I get that those connections I think are so important and often overlooked, and that you've seen so many people and can start to make those correlations to some physical or mental or emotional trauma that's happened, and things just get stiff and blocked up, and we have to open up those communication highways, right, in the fascia, in the lymphatic system, in the drainage systems to get things moving again. So maybe I don't know who needs to hear this, whoever's listening to this or watching this, that maybe something did happen to you and you're struggling. Try some of these techniques and have the sort of putting that positive energy back into your body, that you're helping yourself and you're able to get things flowing again. And you may even have, which I've experienced with my patients over the years, that when you start to do something manually or physically, I used to do a lot of craniosacral therapy on my patients and some energy work and healing and things, and you work on what seemingly is the physical, but they end up having an emotional release, and they're like, okay, what was that all about, right? And often they can tune right into exactly what it was that they were holding on to for so long, and then they have that release, so then that pain never comes back again. And that's the beauty of doing any type of hands-on work, whether you're working on yourself or you're working on other people as you do every day, that you can have these remarkable sort of magical things happen in terms of letting things go, because the more that we're holding on to, the more that we're stuck with our energy, and that could be manifest into the physical body and in your lymphatic system. It may be connected to something deeper. So like I said, I don't know why I'm saying this, but somebody needed to hear it, just to work
Yeah.
things through, and always, love yourself and give yourself that loving, healing attention and energy, which I think in our modern age, I don't know about in Norway, but here in North America, we're like, go, 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 fast pace. We got to get it done. We have to do this. We have to accomplish all these things. But is that really healthy? I mean, if we can't take 5-10 minutes to do one of your techniques just to help ourselves, right? We have to ask ourselves these questions.
I made a video yesterday about how you have to be in the now. You cannot be in the future. You can't be in the past. You have to be in the now, because it's here now. You can affect or make a difference. So you need to
Yes.
be in the now. And I have a song I love. Let it go. Let it
Uh-huh.
go. Let it
Let it
go.
go.
Yeah.
Yeah, love it. Love it. I
Yeah.
know. Yeah,
Yeah.
it's so good.
Stop worrying. Let it go.
Yeah.
And keep you have to focus on where your focus goes, your energy flows. You need to have positive energy, but how can you have the positive energy?
Yeah.
If you want to become pain free, you need to address the problem. And often the problem is that we worry, we stress, and then the tension comes, and we get problems.
Right, exactly.
Yeah.
So getting pain free, that's what we're talking about here today with Rune. Did I say it right?
Rune.
I'm,
Yeah.
I'm
Rune.
trying.
Rune.
Rune. Okay, I'm getting
Rune.
better. Rune. Okay,
Yeah.
let's
Yeah.
talk a little bit about TMJ. So for people who have chronic issues in their jaw, do you have some techniques for this?
Yeah, we have a big muscle called the masseter. It's located in the jaw area. And when we tense up or we stress or we are living in the past or not in the present, this jaw is clenching up. And when then this muscle is contracted, it will pull, like we are told it, I have tried to teach you. And when this muscle is too short, you can locate it by doing like this, go in with your finger, I pull in just in between my upper jaw and my lower jaw, and I
Yep.
go backwards like this, and you can feel the masseter there.
Yep. I got
Okay.
it. Yep.
I like to use my thumb or my knuckle because the knuckle is strong and the thumb is stronger than my finger. So I go with my thumb like this, and I squeeze backwards
Okay.
like this.
So for people that are
For
listening to
people,
this, yeah, this is the like sort of your chewing muscle, right? The masseter that helps to
yeah.
control your lower jaw. So you can feel it in, the middle, underneath your cheekbone, between maybe halfway between the corner of your mouth and your ear. That's roughly the place for people who are listening, where we're finding that
Yep.
masseter, and we're kind of using our finger to go back and forth. You're sort of rolling the muscle belly with either your thumb or with that, knuckle, your middle finger knuckle, rolling back.
Mhm.
And yeah, mine's quite painful as well there. Oh my goodness.
Yeah.
I think
So
we hold a
be
lot of
careful with this
tension.
one.
Yeah, you can't overdo
Yeah,
it, correct? Yeah, okay.
correct.
I yeah, okay,
This
so
should be soft. It should not.
it should be
Do
nice and
both
soft.
sides. Check. Yeah.
And then after you roll over the muscles, do you usually like then massage the area to sort of flush things out?
I'm only checking the tension in the muscle. So
Oh, okay, yeah.
if I go like, yeah.
So you check
So
first, and then you sort of massage out that tension.
first I go like 4 or 5 times like this,
Okay.
and then I can check. I can feel the tension in the muscle, and then I go like that, and I go squeezing backwards. Now I can feel there's not much tension left.
Right.
It's softer to go through it like this.
Okay. So you know that you've released it. And talk
It's
about
softer. So,
yeah.
yeah.
And okay, because one of my questions coming out is about the beauty aspects of doing this, because we can see, anybody who's watching this, you can see how nice and red we've become
Yeah.
in our blood flow that comes to the face. I mean, this is amazing for anti-aging. I love it. I love it.
Yeah. So people come with like cheekbones, and we cannot see the cheekbones or the like, or this, what is it called? I don't know. But if you have tissue fluid stuck in your fascia, we need to
Yes.
drain those by opening up the masseter, opening up the sinuses, opening
Yes.
up the sinuses on your eyebrow. Then you
Okay.
get better circulation through this area.
Right. So for people who are looking to improve their jawline, let's just go right into the beauty stuff right now. Looking to improve
Yeah.
the jawline, or if you're getting the jowls or the double chin thing happening,
Yeah.
these kind of, the masseter would help with that one, I'm thinking, and for the TMJ as well, these moves would help.
It will help, but people will not think that my double chin is going away, because the double chin maybe is not only tissue fluid or
Right,
lymph.
right. Yeah.
It could affect it, but it will not drain all the double chin away.
No, of course, of course.
But
We don't want to give false hope here, but
yeah.
yeah.
Okay. So by draining the masseter muscle, there's a lymph node. You have this sternocleidomastoid. The muscle is just above your collarbone, and
Yeah.
it's a very long muscle, and it's behind of your head in this area. So if this muscle is contracted, it will pull on your neck, and it
Okay.
also block your throat, the circulation to your throat.
Right.
So it could give stiff neck, it could be sore throat. So by draining this lymph node, we're going to use the pinching technique on
Okay.
this muscle. So I go in like this, holding
Okay.
the muscle,
Uh-huh.
and it could be painful, and I'm
Yeah.
twisting it like this, holding
Twisting
it
it
and twisting it
towards
like that.
your front. Oh, yeah.
Yeah, exactly. Twisting, pinching it and twisting it.
Oh, yeah.
Then the tension in the muscle.
Yeah.
Yeah, exactly.
I can feel it.
Yeah, it should be soft, should not be tender or hard, this muscle.
Yeah, I wonder,
So
because
when
I
this,
was, fighting. Sorry. I'm wondering, mine might be tight because I was fighting something with my sinuses up here, right? So it's
yeah,
blocked. It's not draining. That makes sense.
or the tennis.
Yeah, it could be, the pickleball too. Exactly, right? Because it's
Yeah,
all connected. Yeah.
yep. This,
All right.
using your shoulder over and over again will block.
All
So the
right.
good part with all the techniques I'm trying to show and teach people, I use on my clients.
You
So
do.
I know all the techniques. So I some all the techniques I'm showing I know work because I've been using them for the last 11 years on my clients and the last 10 years on myself. So I have been treating myself for headache or stiff neck or tendonitis.
And what a great mission that you have, to be able to share your knowledge. And I encourage everybody to check out all of the work that Rune, did I say it right? Has shared online, because he has so many, wonderful and easy, the way that you explain your videos and your techniques. It's easy to follow, and it's quick, and it really does help, and it works very quickly as well, which I hope everybody's going to use these techniques that we shared today in today's episode to help themselves. And definitely, I'm sure that they can comment on your social media as well if they have something specific that they'd love for you to do a video on, if you haven't yet done it. But I mean, you have a vast array of techniques, and of course you have your ebook as well, which is available. So a lot of great resources for our followers to be able to get in touch with you and, help to share your work. I mean, that's one of the greatest compliments that I get from social media is when, my followers will share my content with others, so that we can all help each other and create this, greater and vaster space of like-minded and healthy and, very positive people to make this world a better place. So I thank you, Rune. Thank you so much for spending some time with me. Such a fantastic interview, and everybody has to check out all of his content online. Thank you so much.
Thank you for letting me come to you. Thank you.